you all are running the bEHRATHON, which aims to engage with 1 million participants. Can you share more about that vision and how everyday people can get involved?
In April, I took over 2 million steps in 30 days.
Why do you do that?
So to raise awareness about Bear Health and the official launch of our app that's going to be taking place in October. Right now, we are operating on our beta platform, but we've generated enough traction and gotten enough engagement over the past year and a half to get migrated over to our own independent platform and to kind of celebrate that launch and just get as many people as possible engaged with that movement. I decided to go after the world record for the most steps in 30 days. And I didn't know if I could do it or not. And I had been training a bit for a 10K that was coming up in April, but I just took it one day at a time. And the first day was incredibly challenging. I walked probably 14 hours that day. I was walking too slow. I didn't have my pace down just yet. And so I started walking at 5 a.m. Maybe was off my feet 3 hours throughout the day, and I finished walking at 11 p.m. And it's funny, I was literally walking around my friend's island in her apartment at the very end, just trying to get the final steps. And I was like, man, how am I going to do this for 30 days in a row? Because that's another thing. I had no margin for error. I had to do 67,000 steps a day, with about 30 to 35 miles of walking per day. And if I missed 20,000 steps one day, I think it's going to be hard to make that up. So it definitely was a challenge. I would say that was probably the most challenging aspect of it, is that there was no margin for error. And there were nights I would immediately, as soon as I finished walking, I would just lay down, and then I'd wake up and then get back to walking for the next day. But it was a really cool experience overall. Like I said, I averaged about 67,000 steps per day. My highest day was 87,000 or so. And I was really encouraged that my body was able to kind of adjust. Right, first 5 days were really tough, and I felt it everywhere, all day, every day. There would be times that I'm walking, and then all of a sudden there'd be a shooting pain in like the inner part of my knee. I'm like, what was that? I stretched for a second, walked for another hour, all of a sudden same pain. I'm like, okay, so what's going on here? And I have no idea. My body's just freaking out because I'm putting on, ridiculous amounts of miles. But after about 5 days or so, started to adjust. Started fueling properly. I wasn't fueling properly in the first few days. It's just hard to keep up with that much demand, and I already don't eat that much in general. And so to have to ramp up how much I was eating while also ramping up how much activity I was doing, it's just a lot. It's just a lot of effort in general. And so it was difficult. So when people did start bringing me food, lots of beans and rice, and we got it done, man. So that campaign was just, kind of kick it off. And at the end of the campaign, people kept asking me, what's next? Which I was actually confused every time somebody asked me that. Like literally on the last day, just, finish crossing 2 million steps. So that what's the next challenge, bro? I'm like, man, I'm not even thinking about that at all right now. I don't even know why I would be thinking about that. But, I took that seriously and then kind of thought on it. And that's where I came up with the idea for the bEHRATHON. And so the bEHRATHON is in keeping with the theme of breaking world records. We're going to try to break the world record for the most people participating in a virtual run/walk event for the official launch of the Bear Health app this fall. And the theme is Bear Health to the moon. So our first goal and true goal of the campaign for this year anyway is to cover enough distance as a community to reach the moon. So it's about 239,000 miles from Earth to the moon. And since this is our launch, we're launching into space. That's kind of how the theme works. And so we want to get enough people on the app to where we could cover enough distance as a community to reach the moon. Ideally, we have at least 100,000 or so that participate in the bEHRATHON. That way, everybody only has to do, 1 to 2 miles, nothing crazy on bEHRATHON day. But, if we don't get that many, let's say we get 20,000, then, each of us will have to do 10 miles. But like the idea is like, to make it easier on ourselves, let's get more and more and more people involved. So yeah, to participate and be a part of that, you can go to our Instagram at Bear Health, to bEHR Health. There's a link tree in the bio, and it'll be there. You'll find the registration page there. It's free to participate, free to download the app. when it does come out, there will be a subscription associated with it. But I think we're going to do like the first 3 months free, just so everybody can get into the bEHRATHON and experience the app before deciding to make a commitment to being a part of our community. But it's only going to be $5 per month or $50 per year, so pretty affordable. But ultimately, we do want the platform to be free to everybody. And if someone emails us and says for whatever reason they don't want to pay for a subscription but want to have access, no questions asked, we'll give a subscription to the platform. We'll definitely start off like that. So yeah, that's what that's all about.
Well, congratulations to you. That's amazing that you're able to do that and like persevere throughout that. I can only imagine the strain and torment that your body and maybe even your mind went through during that time. And you said that you were preparing for a 10K. I looked it up. That's like 15,000 steps. That's nothing close, nothing close to 2 million. So,
Yeah,
so I don't think
technically the 10K didn't count. Didn't count towards my steps because I was running. So.
Right. I remember people asking like, "What's next?" Probably like 24 hours of sleep. That's what's next.
Something like that. No, I definitely was laying down. I was horizontal all day the next day. I think I took under 1,000 steps. I forget, but.
And when you were getting those pains in your knee, and I'd imagine the thoughts in your mind like, should I do this next step? Should I do this next mile? Well, what kept you going?
That I might be okay. Like, sure, certain things are pointing toward me not being okay. Like my knees hurt every step. I was starting to get sharp pains in my head, like early on as well. So like dehydration and just lack of fuel in general. So that actually is what made me the most nervous throughout. And then I had some significant Achilles pain about 10 days in. So I could walk with no pain, but anytime I tried to push off at all to run, it's just severe 10 out of 10 pain. And so that was concerning because I don't want to damage my Achilles. I still want to be able to move for a significant amount of time in my life. So what got me to keep going was, one, I told the world I was about to do it. I couldn't just like stop day 10 and be like, all right, guys, now I'm sure people would have understood and like everybody would have forgot about it. But then I'm this guy that sets ridiculously ambitious goals and doesn't even come close to them. And I don't want that for myself. What else helped me keep going? People bringing me food, people walking with me. My favorite part of the whole experience was when I would be on a walk, just like on the neighborhood kind of walk path. Someone had maybe seen a post on social media about me and would walk up to me like, "Oh, wait, are you the walking guy? Like you are me and my friend's inspiration." And when I think about the word inspiration, that's all I think any of us should be trying to accomplish in life. Like that's the feedback loop that I think is most valuable for humanity, is where if the way that you live your life, what you choose to do, who you choose to become, makes someone else feel like life is worth living to the point where they would commit to something that makes sense for their life as far as growth, then I don't think that our souls really want for much more or need for much more than that. And that wasn't something I necessarily expected, like people to be inspired. I thought people were going to think it was like cool and interesting, but like to be inspired, that, when I think about public health, one thing that I think is missing from public health is like within the definition is something that speaks to that. Because right now the definition is public health is the art and science of prolonging life. We can prolong life for a long time and we can keep sick people alive. But like, how do we set up society such that we can prolong the desire to live? Right? Because the desire to live is the root of longevity. If you want to be here, you can at least leverage that perspective to get creative about what you might need to do to be here as long as you possibly can, right? I don't know how to exactly measure these, but I've heard anecdotal stories of, people on their deathbed or just struggling with a condition. Those who really, really, really want to be here, or your body's listening to you all the time. And these are just accounts from doctors that I speak with. If you want to be here, like the patients that really want to be here, like they are more likely to survive. Again, because your body's listening, your cells are trying to figure out, okay, well, I need to be here. Let me figure out what I need to do to make sure I'm still alive. And so that's really my vision with bEHR or my vision with public health is to how do we set up society such that people want to live here, be here as long as they possibly can, not to miss out on the experience that we've created, because we can do it. We should not be in these conversations about this big beautiful bill or whatever it's called, and how now a significant amount of people aren't going to have access to basic needs. Like, that's not what we should be talking about. There's more than enough to go around. Like, these are unnecessary challenges that we're facing, and everybody would benefit from it. Everybody would benefit from everyone doing better. It's just a fact. And so yeah, that's what I want to create. I know it's possible, and honestly, it's gotten challenging enough to where we don't have much to lose. So yeah,
Yeah, yeah. That makes a lot of sense. And I definitely think so. We should be worried about other things that aren't issues that we are creating for ourselves. We
exactly.
should be worried about poverty and feeding all children, but we refuse to get there for some reason.
Mhm.